Hello everyone, welcome back to my channel. My name is Morolake Ajibola. I'm a registered nurse. To my subscribers, welcome back to my channel once again, and thanks so much for subscribing to my channel. God bless you. And if you are viewing me for the first time today, I welcome you to my channel as well. My channel is all about enlightening individuals about some health challenges which can be prevented if individuals has the knowledge to do so, and also to talk about some health issues which has to be managed appropriately in order to prevent complication. Mostly I talk about women's health, and today again I'm going to talk about an infection that affects women alone. And the infection I'm talking about is vaginal thrush infection. If it's something that you like to know about, come along with me. Welcome back to my channel. I'm going to talk about vaginal yeast, which is also known as vaginal thrush or vaginal candidiasis. It's a fungal infection which is caused mainly by Candida albicans. Mostly 10 to 20% of women harbor these fungal species without causing any symptoms or problem, and it does not require treatment. But there are factors that predispose a woman to actually have vaginal thrush, which are any changes that can affect the normal flora in the vagina or vulva wall, like the use of antibiotics or spermicide. Another thing is vaginal douching, introducing of water or fluid into the vagina in order to wash it is also a risk factor for vaginal thrush to occur. Pregnancy is also another risk factor for a woman to actually have vaginal thrush, because pregnancy causes hormonal changes which affect the normal flora in the vagina vulva wall, and this can prompt a woman to have vaginal yeast. Another thing is uncontrolled diabetes. It can also alter the normal flora and predispose a woman to have vaginal thrush. Immunosuppressant disease or treatment is another factor. Immunosuppressant disease such as HIV, AIDS, cancer, or treatments, radiation treatment. Wearing of wet clothing also predisposes a woman to have vaginal thrush. Maybe after leaving the swimming pool, the wearing of wet clothing for a very long time actually enable the candida species to thrive well in a moist environment. Wearing of nylon underwear is another factor, because wearing of nylon underwear actually encourage it to trap in the genital area, which serve as a medium for candida species to thrive very well. These are the factors that actually predispose a woman to have vaginal thrush. Signs and symptoms of vaginal thrush. Number 1, intense itching, burning sensation, painful urination, painful intercourse, thick cottage cheese-like vaginal discharge, swelling of the area because of the inflammation process, redness of vagina or the vulva area is also a sign. Is also another signs of vaginal thrush. Any person experiencing vaginal candidiasis can actually have one or more than 2 of these signs and symptoms that I've mentioned. So what are now the preventive measures to prevent vaginal thrush? Number 1 is to use antibiotic responsibly. It's so important. Use it only when it's being prescribed for you. Another thing is, if you are experiencing recurrent vaginal thrush and you are using spermicide, there is need for you to talk to your family planning provider in order to choose another protective measure for you. Another thing is, it's more preferable to wear a cotton underwear than nylon underwear, and stop vaginal douching as well. This can actually prevent prevent a woman from having a vaginal candidiasis. Also, in an immunocompromised patient, the only thing that they can do is to just boost their immunity by sleeping well, rest well, eat a lot of fruit is so important. In some cases whereby we cannot do much about how to prevent it, like pregnancy, the only thing is for the person experience vaginal thrush during pregnancy to actually maintain all the preventive measures that I've mentioned earlier, to prevent wearing of wet clothing or sweating clothing, and to actually prevent vaginal douching and avoid unprescribed use of antibiotic is so important. And in a diabetic patient, they should ensure that their sugar level are properly controlled. These are all the measures that a woman can follow to prevent having vaginal candidiasis. So now moving on to the treatment modality, because when a person has this infection, it must be treated. Having the infection needs to be treated. That is very important. The thing to do is to visit your healthcare provider, explain about your signs and symptoms, together with an investigation that is going to be carried out in order to make a confirmed diagnosis that you are having vaginal thrush. Investigations such as eye vaginal swell can be carried out to actually confirm that you are actually having vaginal thrush. This is very important. And what are the things or drugs that they are going to prescribe? They are going to prescribe antifungal drug, and most of antifungal drug are nystatin, which can be in tablet form, tropical form, in form of a cream, or vaginal suppository, whereby the individual use an applicator to apply it to the vagina, and is mostly used at night. Fluconazole is another common antifungal drug that can be prescribed for a person that is experiencing vaginal thrush as well. So these are all the treatment modality, the signs and symptoms that a person will experience when having vaginal thrush, and the treatment modality as well. So I've come to the end of this video. If you have stayed with me to the end of this video, thanks so much for staying with me. And until next time I'm doing another video, take complete charge of your health. Bye for now. Bye bye.